Okay, so I have a specific case to tell you about. This case was a 47-year-old male who came to see me in the clinic after having his arm bent by his wife. She was fed up with him complaining about it and made an appointment, and he came in with a 2-month history of heel pain. He was quite an active patient, or is quite an active patient. He liked to walk to work. It was a couple of miles walk to work every day. And he liked to do that walk and walks after work as well, for both his physical health and for his mental health. He had to wear safety shoes to work, and that was kind of a non-negotiable. And we all know that those are kind of the lesser of two evils, really. But his heel pain meant that he was struggling to walk at all. He had to sit in his seat once he got to work. So he had that kind of difficult cycle of activity followed by rest, which caused it to kind of stiffen up and seize up and become painful again. And it was causing him real problems when he came to see me. So I'll not go too deep into my assessment with him, but we checked him over, and he had pain and palpation of plantar fascia insertion, just that typical medial tubercle of the calc, and some edema present over that as well. His pain, he was also feeling it into his arch as well, along the medial slip of the plantar fascia. He complained of first step pain, so, you know, very classic kind of plantar fasciitis symptoms. We're fairly confident. Unfortunately, I don't have an ultrasound in my clinic yet. It's on the want list, so we couldn't scan him, but just going on his symptoms and our assessment, it was fairly obvious that it was plantar fasciitis that he had. He described his pain as a 7 out of 10 at worst when we asked him about his pain score. When we asked him what, you know, if anything had given him any relief, he said that he'd done the typical Googling plantar fasciitis, and he'd discovered that rolling a ball or, you know, a chilled bottle of water was the thing to do. So he'd been doing that, and it did give him some relief. He'd also bought himself some cushioning arch supports, just the typical kind of soft gel arch supports, which he also felt helped him a wee bit. And so that was fine, but he still wasn't getting, you know, that had kind of kept him at the 7 out of 10 and gave him a bit of relief, but it wasn't improving it for him. He was still struggling. I'm flying through this, Steve. So at his first assessment, on his first treatment, we decided just to go ahead with the laser because he wanted to get better as quickly as he could. And that's what we find with the laser. It can, not always, but very often give you really quick results and reduce pain very quickly. He was one of these fabulous patients that are so satisfying to treat with the laser, who experienced immediate improvement after we treated him. So I actually can't remember exactly which settings I used for him, but I always use the scan phase first. So we did a scan phase, and then I kind of rocked the boat a little bit by favouring the Achilles tendinitis setting for the plantar fasciitis, which doesn't give a scan type treatment like the plantar fasciitis preset does. The Achilles gives you a point by point, so you treat individual points rather than doing a continuous movement with the laser. I like doing that because I like to be able to focus on specific areas of pain and around that. So I focus my treatment on that medial calc, the area around it, and then into that medial slip of the plantar fascia as well. And I also usually do trigger points too. I tend to stick a trigger point over the area of pain to hit that kind of acute element of the pain. And then I did some trigger points up his calf muscles as well, into head-to-gastric, you know, just palpating for them and treating them with the trigger point setting. As soon as he set his foot on the ground, he noticed an immediate improvement and put his pain level at that time at a 3 out of 10. I also gave him some taping. Just a standard low dye taping to do to support his foot. We gave him an exercise program to get him loading his plantar fascia, and because his current insoles were giving him some relief, and because he'd shown quite good initial improvement with the laser, rather than giving him new orthotics, I just told him to continue wearing the ones that he had, rather than spending money on a new pair that he might not necessarily need, and if he did, he wouldn't necessarily need them for long. And he was really happy with that. So I saw him a week later, when he came back, his pain was now kind of at a steady 2 out of 10. So he was doing really well. The pain on palpation and the edema were both very much reduced. He's one of these patients who wanted to be completely better. So we decided just to repeat his laser treatment again. So we just did the same treatment as the previous week, and advised him just to continue with his treatment plan as he'd been doing until his review appointment, which was 1 week later. And again, he was quite happy with that. At his review appointment, he was absolutely delighted. His pain had resolved. He'd been able to get back to walking to work again. And he lost that first step pain. He wasn't concerned about, standing up after sitting down, things like that. And he's one of those patients who's kind of dropped off my radar. I haven't seen him again in the clinic, but because I live in Orkney, there are no secrets, and I see him out walking all the time now. So I know that he is okay because he's going for his evening walks, because I drive past him and I see him. So he was a very satisfying case, because in that space of 2-3 weeks, he'd gone from a 7 out of 10 to really a 1 or a 0 out of 10, and had got back to his kind of everyday activities and was very happy. So I was very happy too.